In this video, we're going to complete the histology review that you're responsible for in the lab regarding digestion, respiratory system anatomy. If you've already gone through the video about the digestive histology, you'll notice that it has a similar distribution of tunics that you would have seen in an alimentary canal organ. In fact, in our lab, the esophagus and the trachea cross-sections are on the same slide. So you have to be able to distinguish between the two because they seem to look familiar or similar to one another if you're not yet familiar with the distribution of tissues and tunics. So to begin with, we'll look here at the tunic. Once again, this is where air would be passing back and forth. And you can see the mucosa right through here. Just beneath that in this image, you see the submucosa. And then instead of a muscularis layer here, we actually see a big slice of hyaline cartilage. If you were an AMP1, this should look very familiar. Otherwise, we're going to take a look at it here in just a second. And you see an outer layer of what would essentially be like serosa, but we just referred to the tissue itself as adipose tissue. So of course, as we begin to zoom in right here, I want you to take a nice look at the mucosa. So the mucosa itself is still going to have that lamina propria, right, running right underneath a layer here of epithelium. Right? The epithelium is pretty unique. Let's zoom on that for just a second before we come back. The epithelium is a pseudostratified, ciliated, columnar epithelium. So first off, the cilia that you guys see right here are different from the microvilli you would have seen in the small intestine. The cilia are actively moving and basically propelling debris up and out of the trachea. And so you'll see the cilia there, much like the brush border of the small intestine. These are columnar cells that you see, but the unique visual representation of these columnar cells is such that the nuclei don't sit in line with one another, as we saw with other types of simple columnar epithelium. And so it gives this appearance that you're looking at a stratified tissue type with multiple layers. Again, since this is not really the case, it's pseudostratified. So please make sure you know the name of that tissue, plus the fact that it is in the mucosa. If we go back here to this 100x magnification, within the submucosa, you see a series of what are called seromucous glands. These seromucous glands are going to be secreting here within the layer lining of the trachea itself at the lumen to help pick up some of the debris and create a sticky substance that catches that debris before it passes further down into your bronchial tree. And then down here you can see that nice strip of hyaline cartilage. Hyaline cartilage in itself is a very glassy looking tissue, but it stains pink when you're looking at certain types of slides. And the most notable characteristic of the hyaline cartilage is a series of holes here. They look like eyeballs, right? This is a cell type called a chondrocyte inside of a little pocket called a lacuna. And so this is pretty typical of the three types of cartilage within your body, hyaline cartilage being the kind that you see here. It's predominantly made of collagen fibers here in the matrix, and so that's what gives off this nice pink appearance in this slide. So again, if you're looking at something like the esophagus, this layer here would be where you would see smooth muscle. So since you see hyaline cartilage, it should be a dead giveaway that you're looking at the trachea. Okay. So of course, as you inhale air and it moves down the trachea, it's going to slowly move through a series of bronchi, right? And then further down into smaller and smaller regions of the bronchial tree. And so at 40x magnification of one of the lung slides, you can see quite a few of the cross-sections of a single bronchus, right? And the bronchus itself is going to be the largest part of the microscopic components here of the bronchial tree, just after the trachea. And it still is hollow, so you can see the nice lumen right here. And even from this view, you can see that there's going to be a series of tunics. So you can still see that there's going to be epithelium here that lines what would be a mucosal layer, right? And you can still see those eyeballs, right, through this layer, which indicate to you that you're looking at hyaline cartilage. So as we zoom into this and you get this nice view here of the bronchus, you can still see that you've got pseudostratified ciliated columnar epithelium in this place lining the lumen. There's a lamina propria, right? And there's that nice hyaline cartilage layer. And that's as far as we go here looking at the bronchus. So please make sure that you can identify it here from 40x magnification, as well as identifying here the individual layers of a single bronchus at a higher magnification. As the air moves from the bronchus, it's going to move through a series of smaller and smaller bronchi as you move throughout that tree. And then eventually it's going to run to a bronchiole and a terminal bronchiole and then alveolar systems. And so as you look back at this 40x magnification of the lungs, here we're looking at a different location. you can see some of these smaller components. So what we tend to start with right here is a bronchiole. Right? So we have you guys looking at bronchioles. Make sure you can differentiate those parts of the bronchial tree from blood vessels, right? So when you see a pulmonary arteriole, you should see blood inside. When you're looking at parts of the bronchial tree, you will see clear space inside of those. So the bronchiole itself, if we begin to zoom in on it just a little bit right here, you're not going to see hyaline cartilage like you would have seen when you were looking at the individual bronchi. Okay, so it's a much thinner tubule, right? And it's going to have a thinner layer here around the outside. This is where you're going to still see quite a bit of columnar epithelium or cuboidal epithelium, depending at what point you'd see that cross-section made. But as air flows from a bronchiole, it tends to flow into smaller and smaller chambers that you can see connected to the bronchiole here in this image. And that's what I'm trying to show in terms of the arrows here, right, as one thing that they indicate. And then, of course, it ends up in these little pockets that you guys can see here that I've marked out here in yellow ovals and circles. So let's name these structures based on how you would see air flow through them. So again, here's your bronchiole, very distinguishable here. As the air flows out and it enters these tiny alveolar sacs, which are clusters of tiny alveoli, it moves through what we call alveolar ducts, and that's what is symbolized here by a red arrow. So that's an alveolar duct. It's essentially a divergence in the airflow as it moves from the bronchiole into different alveolar sacs. So of course, if you were going to zoom in on these alveolar sacs, what you would see, are singular alveoli. Now, of course, you could basically outline those here. This would be one alveolus, right? This would be another alveolus right here. Here's an alveolus. You can see the nice little rounded edge. There's an alveolus. But sometimes it's a little bit easier to recognize an alveolus that has all of its borders. So this would be an alveolus right here with simple squamous epithelium all the way around it. Right? It would be a part of an alveolar sac, but based on where you see the cut here in this image, you just can't see all of the sac. We do have a lung slide in lab just for fun. You can look at a smoker's lung, right? And you can look at a lung of emphysema. Keep in mind that when you see that lung with emphysema, you'll notice that there are fewer and fewer of the alveoli, right? Which basically diminishes the amount of surface area that you have for diffusion of gases. So that's one reason that patients with emphysema have such a difficult time breathing. So of course, as we move from respiratory into lymphatic, you can see the spleen. Right? The spleen in itself is going to be a combination of immune function as well as blood function. And we divide these up into different layers. So to begin with right here, you can see what's called white pulp. Now, ironically, it is purple, but it is named because this is where you tend to see most of the white blood cells, leukocytes, and those just tend to stain purple. And so that's why you see purple wherever the leukocytes are clustered. The majority of the other regions all the way around are referred to as red pulp, and this is where you have a series of capillary, like sinusoidal capillaries running all through the organ, where you can have those old and non-flexible red blood cells flow through the liver, flow through the spleen in those bigger capillary sections. All in that region as well, you would expect to see a lot of macrophages that can then begin to degrade those worn out red blood cells. And so that's the spleen. Make sure you can identify white pulp versus red pulp when looking at that organ. A tonsil is very similar to that. You're still going to see what looks like white pulp, but these are referred to just as lymphoid follicles. Right? Again, these are also very similar to Peyer's patches in the small intestine. And a tonsil in itself has a lot of crevices that run through it. We tend to call these tonsillar crypts. You can see a few of them right over here on the side. So nice tonsillar crypts over there on the side. Quite a bit of immune function there as dictated by presence of white blood cells like you would have seen in the spleen. And then, of course, there's the lymph node. Once again, you see lymphoid follicles, right? Again, like the Peyer's patches, much like the white pulp. The thing here about the lymph node, and this is different from the tonsil, is that those lymphoid follicles tend to be grouped into a particular layer. So here that layer would be the cortex of the lymph node. And as you move past the cortex, this region is going to be the medulla. It has a lot of those chambers for lymphatic flow, okay, little sinusoids for lymph flow, all through the middle layer of the medulla. And that is it.